Hi, Dr. Bill here. Welcome to our newsletter blog, and I'm going to talk to you about the effects of painkillers on spinal pain. Again, some research was done to test the effectiveness of painkillers, and the references for the research are included with this video. And they used what's called non-steroid anti-inflammatory drugs, or NSAIDs, non-steroid anti-inflammatory drugs, to test the effectiveness of painkillers on pain in the spine. So there are two groups. There are a placebo group where they got a pretend painkiller, and the other ones that got the real painkiller. And what they found with the results was that there wasn't any significant difference between the two groups. The ones that got the placebo didn't fare any worse, and the ones that got the actual drug didn't fare any better. In fact, there was a slight but insignificant better result with those that got the drugs. So if you do have spinal pain, what this research says is that the taking the NSAIDs is not going to do you any good. In fact, it can actually do you harm, because the research shows that it can cause gastrointestinal problems, things like bleeding and stomach ulcers. So I'm not saying don't take a painkiller when you're in pain, but certainly I would keep it in mind what we've just said, and there are other things you can do. The big point about this is if you have pain, there's got to be a reason. So just taking the painkillers is fine temporarily, but what are you going to do if the pain persists? You've got to find out what's causing it. So usually with spinal pain, it can be muscular in origin or ligamentous, which we call soft tissue. And if that's the case, then often a massage or even acupuncture, if you're brave enough to have that, can actually be quite helpful, or physiotherapy can be quite helpful when there's a muscular involvement. If the problem is coming from the joint dysfunction itself, such as an alignment in the vertebra, or much worse with a disc involvement, then obviously you have to correct that mechanical problem in the joint. This is where osteopaths, chiropractors actually can be used. Now, obviously, being a chiropractor and an osteopath, I've been treating spinal pain for 40 years, and it's what we treat, mostly in our clinic. That's what we do. We treat spinal pain. So we've had a lot of experience with that, and you can also, there's certain creams that you can use that sometimes help, especially if it's muscular. Now, heat can often help a muscle problem. Cold can help if it's a nerve involvement, and most pain does involve nerves. But that's why, if you're not sure, you can use hot and cold, 10 minutes heat, 5 minutes cold. You do that twice and do that every couple of hours. So it's 10 heat, 5 cold, 10 heat, 5 cold, every couple of hours can often help. But you are in pain, and if it persists, get it checked out, find what the cause is, and get it fixed. So hopefully that's helpful, and Dr. Bill signing off, and I'll see you on our next newsletter. Thank you.